Hey folks! Today I'm diving into everything you need to know about Viagra. So grab a seat and let's get started. First things first, Viagra, also known by its generic name sildenafil, is commonly used to treat erectile dysfunction or ED. If you're thinking about using it, make sure you read the patient information leaflet provided by your pharmacist. Got questions? Ask your doctor or pharmacist, they're there to help. Now, let's talk about how to use Viagra. You should take it by mouth as your doctor directs, usually when needed. Timing is crucial. Take it at least 30 minutes, but no more than 4 hours before sexual activity. The sweet spot for most people is about an hour before. And remember, avoid taking it more than once a day. Heads up, if you just had a high-fat meal, it might take longer for the drug to kick in. The dosage will depend on your medical condition, how you respond to the treatment, and any other meds you're taking. Be sure to keep your doctor and pharmacist in the loop about all the products you use, including over-the-counter drugs and herbal supplements. All right, let's dive into the side effects. Common ones include dizziness, headache, flushing, and stomach upset. Some people experience changes in vision, like increased sensitivity to light, blurred vision, or difficulty telling blue and green apart. If any of these stick around or get worse, call your doctor right away. To avoid dizziness and lightheadedness, get up slowly when rising from sitting or lying down. And a quick reminder, your doctor prescribed this medication because they believe the benefits outweigh the risks. Many folks don't experience serious side effects, but heads up, sexual activity can put extra strain on your heart, especially if you have heart problems. If you experience severe dizziness, fainting, chest pain, or nausea during sex, stop and seek medical help immediately. Rarely, Viagra can cause sudden vision loss or decreased vision, including permanent blindness in one or both eyes. This condition is called NAON. If this happens, stop taking the medication and get help immediately. You're at a slightly higher risk if you have heart disease, diabetes, high cholesterol, or if you're over 50 and smoke. Sudden hearing loss, sometimes with ringing in the ears and dizziness, can also occur. Again, stop taking Viagra and seek medical help if this happens. A rare but serious side effect is a prolonged erection lasting 4 or more hours. This requires immediate medical attention to avoid permanent damage. Most importantly, if you notice any symptoms of a serious allergic reaction like rash, itching, severe dizziness, or trouble breathing, get medical help right away. This isn't an exhaustive list of side effects, so if you notice anything unusual, contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or online at www.fda.gov/medwatch. Before starting Viagra, tell your doctor if you have any allergies or medical conditions, especially heart problems, kidney or liver disease, high or low blood pressure, or any eye problems. Viagra can make you dizzy or affect your vision, so avoid driving or using machinery until you know how it affects you. Limit alcohol and talk to your doctor if you use marijuana. Lastly, if you're pregnant or planning to become pregnant, discuss the risks and benefits with your doctor. That's it for today, folks. Stay informed and always consult your healthcare provider for advice tailored to you. If you found this video helpful, don't forget to like and subscribe for more health insights. Catch you in the next video.